channel. My name is Charlene, and today I am going to be talking to you guys about something that I feel it needs to be talked about a lot, but also I am going to be taking some medication for a skin chronic disease that I have called Hidradenitis suppurativa, HS for short. And today I thought I would share my journey with you guys on since I've been on this new medication called Humira, and how HS developed for me and so forth. So right now I am going to be taking the medication and showing you guys how I apply the medication and all of that. So the first things first is, and I'll go later on after I apply the medications on a little bit of a background story about Humira, about HS, how it's packaged, yada, yada, yada. So obviously you need a cleansing wipe for the area, and then you have the pen, the Humira pen that you will be injecting. Now you have 4 spots that you can inject it. It's either on the left or right side of your abdomen, about a 1/4 inch away from your belly button, or your thighs, upper area of your thighs. They normally say, move around the areas so that you don't end up getting sore by putting it always in the same place over and over again. First things first, always make sure you wash your hands. I did that off camera, so now I'm going to start. I'm gonna put first, I'm gonna get the cleansing wipe. I am going to do my abdomen. I've done my thighs, but today I am going to be doing the abdomen part of it. And you want to get a good solid spot. So I'm going to do about right here in this area. Okay, so you take your cleansing wipe and you are going to wipe around the area, and you're going to make circles, and then you go bigger and bigger to really clean that area. Okay? This is the second time that I've applied this myself. I normally go to the doctor and have them apply it just so I could get familiar with it and make sure that because if you misfire, then you're gonna have to retake it all over again. And these things ship from, is it Connecticut? I might be wrong about that, but you don't get these at your local CVS, okay? So, all right, so make sure you wipe that. All right, now this Humira pen. It's an injection pen. The needle's inside with the medication. It has a 1 and a 2 on it. So always hold it down like this. You're going to take off the 1, right? So then this part is going to be where you are going to be injecting. And then this is the 2, which is going to be where you hold it. So now I am going to turn it, right? This is the part where I'm going to push. So I find that area, and you can always hold where you cleanse it so that you get a more effective injection. And so then you want it about, they say 90 degrees, low key. I don't know if this is 90 degrees, but I just see that this is what they do. And so then you are going to apply it. You're going to push down on the pen, hold for about, they say about 10 seconds, and you'll hear it. I like to hold it just a little longer because I want to make sure that all of it's in there. All right, and then that's it. Q-tip, Wipe away the blood. Okay. And then all set. Now you'll know when it has been injected correctly when you can see the yellow mark in the pen. When you see that part, that means that all of the product has been injected into your system. And so after this, you throw this, you can get a, like, what are those, like needle type of containers. I don't have that, but I just put it in a plastic bag and I throw it away. And so then I'm done. Very easy, very simple. And you feel a lot better, okay? So now I'm going to talk a little bit about HS, Humira, and the benefits and what it's done for my life and my journey so far. All right, stay tuned. Talk a little bit about Humira, HS, my journey on HS, my journey with Humira. And so, yeah. So first things first, listen, I come with the facts, okay? I'm not gonna sit here and try to pretend that I can say everything on top of my head because no, I just write it down, okay? So first things first is what is HS, hidradenitis suppurativa, and it's a chronic skin condition or disease that some people like to call that features lumps in places where the hair follicles, sweat glands rub together. And so they get blocked and result in inflammation and infection of the sweat glands. There is no known cause for this, unfortunately, as of right now. Scientists are still trying to figure it out. But they produce pea to marble-sized lumps under the skin. Very painful. I can attest to that. I don't wish it on my worst enemy. And then they drain of pus and stuff like that. Most places that people get these lumps are either going to be like armpits, groin, buttocks. It's where the skin rubs together. A couple things about HS that people probably don't know or ask questions about all the time. It's not sexually transmitted. So, you know, if you're having sex with your partner or whoever you're having sex with, you know, if you have HS, you can't transmit that disease. It's not caused by unclean skin. So if you're a person that doesn't take showers every day, no judgment over here, but it doesn't, that's not the reason why you have HS. It's not contagious and it's definitely not acne. HS is more common in Black people, especially Black women between the ages of 30 to 39. Most people start seeing it develop or seeing a breakout in their teenage years to like the very first one is like teenage years to like 20. And then after that, most people are like, okay, and then it starts developing even more if you don't get it treated. There is no cure, but there is treatment like Humira. Now, what is Humira? First, let me go back a little bit. I found out that I was diagnosed with HS in 2022. Yeah, like the end of 2021, 2022. I think I had my first one when I was a teenager. Actually, correction. I had my very first breakout when I was in college, my freshman year of college. I got one on my butt and I was just like, what the fuck is this? And so, and then I never had one again. And then fast forward, 2021 is when I had a breakout again, and it started in my right armpit, and it was like huge. Like I thought it was like the size of maybe a grape. Like it was huge and it was very painful. And then all of a sudden, you know, it just spread. It started from here, went to my left arm, on the sides of my left arm, between my breast, on my butt, and then I have one in between my private area. So it was just like spreading all over the place. And then in 2022, you know, they started on medications for inflammation and stuff like that. But I am very much a holistic person. I would rather try holistic versions first before I need to try something else. so and then, so I wanted to try everything I could holistic before I tried something else. And then, after that, I was like, you know what, let me try something different. And I did, as far as the medications that they were giving me. And I was on a boatload of different medications. I think I went through even just the milligrams. They always had to like go up with the milligrams, and then it was just a bunch. And I was just like, you know what, I just stopped taking them. I didn't want to do it anymore. And really it wasn't helping as much as I thought it was, because even though the inflammation was going down, the pain with the inflammation was the worst part. Like, obviously, the inflammation it's gonna hurt because it's trying to heal, and like there's like pus and drain and all that other stuff. But the pain behind it, like that was the part where I was just like, I don't know what else to do, And so anyway, moving forward, it wasn't until the 2023 is when I finally, went to another skin dermatologist, and they were just like, you know what, I think you might be beneficial for Humira. And I was like, okay, what is it? Yada, yada. And they told me everything, and I will tell you exactly what Humira is in just a second. And they told me about it and said like when I could start, and you have to go through insurance and yada yada, because a pen itself, y'all, is like $6,000. One pen, right? So it's expensive. So you definitely need, this is one of those things where you need insurance for sure. And so I started Humira back in, November of last year. So I've only been on it for about 2 months, and it is miraculously different. Like the way I feel, the way I'm more comfortable and confident in my body, and the pain is like, and like I said, I'm a holistic person, but sometimes these drugs that they make, you're just like, you know what? I'm gonna let y'all do what y'all do best. And if this is gonna help my body, I'm all for it, right? And so, we live in a new age. They're always coming out with a new drug. They're always trying to figure out ways to help people in the healthcare system. Not saying that they're the best at making sure everybody can get it, but they're always trying to find new ways, okay? So I've been on Humira for 2 months, and to go a little backstory on what Humira is, I will tell you, and this is from their website. So if you want to know more about it, please go to Humira's website. It's Humira, okay, Humira. And so basically, and this is scientific talking, I'm not a scientist, so I can't tell y'all all the ins and outs of what's really in this product, every single type of thing. Like, no, I'm just telling you what I know off the website. That's it, y'all, okay? So Humira is a monoclonal antibody that recognizes and binds to a specific protein called tumor necrosis factor, TNF for short, which is presented at high levels in ranges of inflammation conditions such as HS. And if you don't know what TNF is, tumor necrosis factor, is a naturally occurring cytokine, which is a protein that is involved in normal inflammatory and immune responses. Higher TNF levels are found in some inflammatory conditions, such as HS. So basically, I have too much high protein in my body. Now, HS will attack normal, healthy body tissues and cause tissue damage. Humira binds to TNF, neutralizes the function by blocking its interaction with receptors. Okay? And you guys are probably like, girl, what'd you say? Listen, I'm not a scientist. I'm just reading off of what it is. I just know that it fights the antibodies of how I have too much high protein in my body. And basically, you know, they say that it differs between weight, hormones, gender, smoking. Like, there's all different types of factors that people put out there that can cause HS to have a flare-up or whatever the case may be. I think for me, it's always been genetic. I just didn't know it, and it's been dormanted until it was, you know, after I got pregnant. You know, my body changed so much and everything just kind of went like whoop, because that's when I really had my first true outbreak since college, was after I was pregnant. And I went through it, you know, postpartum depression and depression, anxiety, all of that stuff. Like, I went through all of that. So not gonna lie to y'all, there were times where I wasn't eating as healthy. I wasn't getting up every single day to take a shower. Like, I wasn't keeping myself to a standard of actually helping my body in a way. But like I said, I think regardless if I was like the cleanest person on the freaking planet, if it's already dormanted, it's already in my body, there would have been nothing that I could do about it. And that's kind of just something that, you know, you have to, I'm big on pay attention to your body. It will tell you what's up. You really have to pay attention to it. And that's something that I do with myself now, especially as I'm getting closer to 30, you know. I want to live in this body as long as I possibly can. I want it to be healthy. I want it to be thriving. So I pay attention to when something doesn't feel right. And it is okay to say, like, no, I think there's really something wrong. And if you have to go to 50 different doctors until you finally get the one that's like, yeah, you know, right, you know what, you were right, do that for yourself. Because for me, I went to like 4 different doctors. And even though they were all constantly trying to prescribe me the same medicine, I was like, I don't want no more of that medicine. Like, I'm good. And so like, do your research, ask the questions that need to be asked, and go see as many freaking doctors as you possibly can if you know that there is something wrong with your body that you can't physically do yourself, even if you are on the holistic version, because sometimes you might just need the scientific version of a medication to help it, like I did. So with Humira, like I said, I've been on it about 2 months. The way that it is shipped to me, y'all, it's ridiculous. Because, I mean, it's not ridiculous, but to me, I'm just like, seriously, y'all can do a little bit different on it. But first and foremost, it comes in this big ass box. Oh, it's from Tennessee, y'all. It comes from a pharmacy in Tennessee called Accredo. And so you have to call them, or like they call you once you take your medication to set up your next ones and like feel it and yada, yada, yada. I take Humira every 2 weeks. It doesn't have to be the exact same time, but it's just every 2 weeks on the day of that 2 weeks. So like today, I took mine today, Saturday. What is it? Saturday, February 3rd. And so I'll take it again in 2 weeks on Saturday. And so, like I said, so it comes in this box. And in the box, it has 2 of these gelatin ice package. Humira does need to be refrigerated. If it's frozen, can't take it. You'll have to call and get a new one. So it comes in these boxes with these ice packs. And then in the box, it has this box, which is where the pens are in. And so this is what the pen is in. So you basically just take it out, take the pen, yada, yada, yada. And then it also has like information about Humira. Now you get 2 pens per package, and that is to last you for every 2 weeks, or however, like sometimes you can take it every 2 weeks, or sometimes you take it every week, depending on how severe your condition is. And Humira isn't made just for HS. There are numerous conditions that Humira is made for. And so I know Crohn's disease is one of them that people use Humira for, and there's just all different types of. So if you have a disease and you're wondering, will Humira be one of those that helps me, ask your doctor. I'm not a doctor, okay? Ask your doctor and get all the information. Like I said, get all the questions, anything that you need to help you become better. Well, help you and become happier in your body. Let's just say it like that, okay? Because let me tell y'all something. The person you see right now today is not the same person I was before I took Humira. I was constantly in pain. I've been in pain since November of 2023. Before November of 2023, I was in pain for like 2 years straight, all the time. Just in pain because I had them in places, and especially your underarms, like you're frequently always using your arms, right? So imagine having these lump-sized peas of pus freaking stuff under your underarms. That's just like, you're just always constantly like just in pain, no matter how you move, what you do, whatever the case may be. I know it took me, like there was days I came home, I didn't want to cook. I barely moved, like, because I was just in that much pain. And it was very hard, especially having a child, and so, you kind of have to push through it. But there was a lot of times where it was just like, I don't even want to move from my bed. I was always at work. I was sitting with just in pain all the time. I didn't really take Tylenol, Advil, ibuprofen, none of that stuff, because really it never helped me. I knew I needed something that was stronger and really beneficial for what was going on with my body. And so the first time I took Humira, they say it normally takes about 4 months until you really start like feeling the benefits of Humira. But I'm telling y'all, it took me a month. It literally took me a month for me to feel the benefits of Humira. I felt pain-free. My lesions were, like inflammation of my lesions were getting smaller. I wasn't draining anymore, and stuff like that. Now I do have to get surgery on my underarms because the walls underneath where I had the like the lumps and stuff like that, they unfortunately, like the tunnels, they unfortunately like overlapped each other. So it's just like the cell wall of the not the inflammation, but the cell wall of like the situation that was basically attacking itself is still there. I don't know if I'm making sense, but I'm making sense in my head. But anyway, so that is a little bit about HS, Humira. For me, my journey on it, I will be on Humira for the rest of my life, as long as it's continuously working for me, as in I feel like it is. Now going forward, obviously, biggest things that I have changed going forward is I don't use fragrant body washes anymore. I use very sensitive skin stuff. I'm not wearing tight clothes anymore, because that is something that can cause, that shaping and rubbing of the skin, and there's no air for your skin to breathe. And if you have lesions, they're not going to be able to breathe, and it's just constantly going to cause more friction and pain to those lesions. Like, they need to breathe, they need to be able to heal. You can put, different lotions on them. Like, I use like CeraVe, or is it CeraVe? Don't know, y'all. But I use that, and I put that on like my lesions, and I can see that it helps kind of alleviate some of it, some of the pain as well, and it starts healing the skin a little bit. Now, I will have scars for the rest of my life, but hey, don't care about none of that. As long as I am pain-free and I am happy in my body, I will take the scars any freaking day, okay? And it took me a long time to really get back to who I am today, as far as being comfortable in my body. The biggest thing for me was I lost 30 pounds in 2022. And so with losing 30 pounds and also like trying to like figure out my eating habits and dieting, which is, okay, if people have tips on the dieting, let me know, because I have tried everything. Like I've tried keto, I've tried pescatarian, I don't even think, yeah, right now I'm about to start trying the Mediterranean diet, because I'm just one of those people now where I feel like I'm not in the mood for chicken, or I don't eat a lot of red meat as much anymore. Like I would rather just eat mostly vegetables or like salads or stuff like that. So that's just kind of where I'm at in my life, and like where I'm trying to move forward as far as like a healthier diet or lifestyle for me. Now don't get it twisted, because I just had Wingstop yesterday, okay? So it's obviously a process to get there, but it's not like I'm eating burgers, fries, and like fried foods every single day. Absolutely not. Make sure you drink your water. It took me about 28 years to really like do the intake of water. Drink your water, people. It helps a lot. You know, make sure you try to get the consumption of fruits and vegetables in your body as much as possible. Try to find more fruits and vegetables that are going to help with inflammation, and try to stay away from foods that don't help with inflammation. Like I said, the fried foods, all of that will trigger your inflammation. That will trigger anything to cause, if you have HS, for any more lesions or flare-ups to happen, right? I didn't write down a list of all the inflammation type of foods you could have, but I know for a fact, like cucumbers are good for you, tomatoes, green beans, carrots are really good, apples, kiwi is really good, grapes, watermelon, a lot of things that have like water intake are really good for inflammation. I do know that. But like I said, people, do your research, find out what works best for you. Don't follow everything that I do, because like I said, I'm not perfect at this. I am still trying to develop what is going to work for me. And that's just going to take time and practice, right? And so this was just something that I felt like it needs to be talked about more, especially as a Black woman, because it is very highly known in more Black people and Black women than any other race or any other gender when it comes to HS. And so, and I feel like a lot of people don't talk about it, or they kind of shun away from it because of what it looks like and where the places are. And you know, you're trying to navigate what your body looks like in front of the world of social media, because people think that there's such a quote unquote perfect bodies, which is absolutely untrue. You can buy a body, but let me stop. But like I said, for me, as of right now, this is the most comfortable that I have been in my body and my skin in years. And I have Humira to thank for that. And all it took for me was just finally being like, you know what? I need to change. I need to find something out, whatever it is. Because I was very hesitant with Humira, because I'm like, I don't know what's in this drug. I don't know what this is going to do to me. And I know for a fact the first time I took Humira, you know, you have to go to the doctor so that they can do it. And then you have to stay so they can watch it, because this is a like very, very high level drug, right? And so, you know, they want to make sure that you're not going to pass out or have like a heart attack or anything like that on it. So, you know, they have to monitor you after you take it, make sure that you're okay. For me, I was just very, very dizzy. That's just kind of what happened. I was just dizzy for a while, very lightheaded. And so, well, other than that, like I didn't really have any issues with it. But like I said, everybody's body's different, so you might react to it a lot different. They will say, you know, if you find yourself having any type of like heart problems, or you know, you can't catch your breath, or whatever the case may be, or you find yourself having breakouts after taking it, stop taking it, call, let them know, whatever the case may be. So yeah, so this was just a little bit about, like I said, my journey with HS, and my continuous journey with HS, my continuous journey with Humira. I am very grateful. You know, everybody's always like, you know, oh, I give, thanks to God and yada, 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 which is true. I give God all the glory. But at the end of the day, I believe that God will talk to you in ways and give you a journey about things so that you can share it with other people. I truly believe my journey with HS is one for me not to keep to myself, but to share with the world, because I know I'm not alone in this journey. I know I'm not alone in this process of, trying to navigate it. How do I feel comfortable in my body again? What type of clothes can I wear to feel like comfortable without people staring at me, or whatever the case may be? And I'm gonna tell you right now, girl, wear the tank top, even if because I have them right here, or this is where I had one. And this is gonna be for the rest of my life. And I did not wanna wear tank tops for a while, right? And I would always get hair that was like 28 inches because I was just always trying to flip it over. And then now, as I've gotten older, I'm like, no, that scar is part of my journey. It's a reminder for myself to know that, like, this part of me does not define all of me, right? This part of me is just a part that I can navigate. It doesn't have to stop my love of life and continue to experience life. And like I said, I'm not alone, and I know I'm not alone. And if people stare, shit, I'm staring at you back. Okay, what's up? Like, I'm just kidding. Okay, like, I'm a lover, not a fighter. So don't come for me. Okay, but I'm just saying, like, you gotta find what works best for you, but just know that you are not alone. And I'm gonna say that a lot in my videos, because I want people to understand that, like, you are not alone. I feel you, I hear you, I understand you. I will never judge you. If you have questions, please leave questions or comments below, like, all of that. And know that this is about to be a new chapter of my life. I turned 29 in a couple weeks, and even though I'm getting closer to 30, I really believe like 29 is about to be my 20-year ending chapter on a great note, just based off of like everything that's happened in my life. And if you continue to subscribe to my channel, to my show, you will see I will talk about everything that I want to share with you guys in my journey of this experience of what we like to call life, because it is a journey, it is an experience. Not everybody gets to experience life. Not everybody's experience in life has been always good. And I think there's always some beauty in it. We just have to find it. And we also have to find a community of people that are going to allow us that open space to not feel judged, to feel heard, to feel seen, whatever the case may be. And that is something that I want to do with my channel. So yeah, stay tuned for a lot of amazing things that I will have on this channel. And they're just gonna be literally simple things that are about me, okay? Like, I'm not out here trying to do the best and have the best and flash off anything, like be flashy or whatever the case may be. It's like, no, this is just simply who the fuck I am. And you either gonna take it or you leave it, but I'm not changing for nobody, okay? So I appreciate you guys listening. Like I said, if you have any questions, you have any comments, please do that below. If you like this video, subscribe and stay tuned for more amazing things. Have a good day. Remember that you are not alone. I see you, I hear you, I feel you, I understand you. I will never judge you, and you are loved, okay? Bye.